Hi, I'm Adam Loveridge with Top Local TV, and I'm here with Dr. Dustin Hopkin of Hopkin OMS. And Dr. Hopkin is a oral and maxillofacial surgeon in the Salt Lake City area. Dr. Hopkin, how are you this afternoon?
Very good. How you doing?
I'm doing really well, and thanks so much for being a expert panelist here with me today. Now, Dr. Hopkin, certainly one of the things that that oral surgeons are known for is dental implant surgery. And my question to you is, if somebody were looking for a dental implant surgeon in Utah or in the Salt Lake City area, what advice would you give on what they should be looking for?
I think the first thing is you want to go with somebody that places a lot of dental implants. There are a lot of guys out there that advertise cheap implants and some of these things, and you typically get what you pay for. One thing that I would look for as a patient would be someone who has the ability to demonstrate that they've received training, i.e. they've had a residency program or some other training program that's been in depth, not just a weekend course or something of that nature. I think also you want to look for somebody who has the right technology to do what's out there and what needs to be done. I speak of the machine that's right behind me. This is a 3D X-ray machine. It's capable of showing me in 3 dimensions the bony volumes, the location of nerves, and the roots of other teeth, such that we don't have to guess where things are. Another thing that comes with getting someone who places a lot of implants is experience. No implant is like the next implant, and so you want someone who's dealt with the different presentations of patient's bone or root structure or lack of bone and need for bone grafting. So I guess, if you had to reiterate, I'd look for someone who has training, someone who has a pretty big implant practice, meaning they place a number of implants a week, not a number of implants a year type of a thing. And then they have the technology, and they invested in the technology to be able to do the job right.
Now, you bring up some interesting points there, and obviously experience is a great deal in dental implants. But if somebody were looking, to replace some missing teeth, or they're looking at the possibility of getting dental implants, and they didn't do their homework in advance, I mean, what are some of the challenges that they could run into, say if they're working with, I don't know, a general dentist or something to do their dental implants that really doesn't, know what they're doing?
I mean, I guess the first thing to say is, there are a number of general dentists out there that are really good and efficient at placing dental implants. However, some of the common things that you're going to run into is inadequate knowledge as far as just how the implant systems work, how to place them. Things that I see often are patients who've had implants placed at odd angles in positions that aren't what we call restorable, meaning yes, the implant's in there and it's solid, but you can't really put a tooth on it or do anything with it because it's not in the right spot. Part of this comes as a challenge because they're not using appropriate equipment to diagnose the patient, meaning X-rays. They're working off 2-dimensional X-rays that don't show us bony volumes. They're having a hard time visualizing root structures and things of that nature. In the upper jaw, particularly, we have the maxillary sinus, which is the hole we all have in our bone, and if that becomes violated or perforated, it can result in infections and things of that nature. So that's something to be paying attention to. We have important anatomical structures in the lower jaw also. There's a nerve that runs through the lower jaw and gives a sensation in the lower face. And so you really want the ability to diagnose properly, meaning having proper X-rays. You want someone who has experience working around those areas. Another thing that I often see is come to my office are patients who someone's attempted to throw a dental implant into a spot without adequate bony volumes. Meaning, the ridge width there just wasn't quite wide enough for that implant to go into, so instead of doing bone grafting to start things up and do it right, they either placed what's called a mini implant or a really small implant, or they just placed it and kind of let it hang out in space. And so those are a couple of things to look for. And that's really where experience comes in and having the proper technology in your practice to diagnose things appropriately.
So the old adage of an ounce of prevention is worth a pound of cure kind of holds true then when it comes to dental implants.
By far. Another thing that I see frequently is people offer these really cheap prices on their implants, and you have to cut a corner somewhere. If you can do your implants for half the price that everybody else is doing them for, something somewhere is being dropped, whether it's the quality of the crown, the quality of the implant itself. It's just like anything else. If the deal seems too good to be true, it probably is.
Well, that's really good advice. Now, Dr. Hopkin, if somebody were looking for dental implants and they came to your office or your practice, what type of experience would they expect?
So typically we have a consultation visit first every time we do implants, and during that consultation visit we're going to look at appropriate radiographs. Not always we have to obtain a 3D x-ray, but if we need it, we're going to get that 3D x-ray done. We're going to have a thorough discussion about implant placement, timing, and sequencing. We're going to have a discussion about the failure rate of implants, which is very, very low. I mean, 98% of implants are successful long term. We're also going to have a discussion about postoperative pain and kind of what to expect. One thing that I'm a firm believer in is that I'm going to throw out as much information as I can to you so that you know what appropriate questions to ask. I had a patient ask me a question the other day right as we were getting ready to do a procedure. I said to her, is there any other things you want to know? And she said, is there any other things that I should want to know? She really had that inquisitive nature to want to know. I don't know everything, obviously, so what do you think I'd want to know? And we try and go over that as much as we possibly can. I also believe that no question's a silly question. You know, if you have a question, it's a good question, and feel free to ask it. Even if it's maybe the second or third time you're asking it, we'll go over it until you understand the process. Because there's nothing more frustrating than getting halfway through a treatment plan, thinking you're done, and realizing that, oh, there's more fees associated with this or more time than we were expecting.
Well, and that's really excellent advice. And you know, other than being an expert in the dental implant field and you know the complimentary consultation that that you provide there, I know that you do some special things for new patients. Tell us about that.
Yeah, so one thing that's always important in a practice, you're either growing or shrinking, and we really appreciate patients providing feedback for us online. As everybody knows, the online presence is becoming more and more important. So one thing that we try and do is incentivize our patients to go ahead and take the opportunity to review us online. And so for every patient that comes in and sees us and then does a review, we give them a $10 gift card just as a thanks for taking their time to fill out that review.
Excellent. Well, Dr. Hopkin, it's certainly been great to get educated about dental implants and some of the things to look out for there, and really appreciate having you on this segment.
Appreciate it. Thank you.